I'm Cherry Maynard Beasley. Known Henry all my life. Grew up we knew each other before the first grade, so that tells you a little bit. I'm from Union Elementary, that community. My grandparents were Maynards, Cumminses, Sandersons, and Brooks. So if you want to know which kind of families I'm from, some of you may have known Dr. Martin Brooks in Pembroke. Is my uncle, Howard Brooks, that he owned a drugstore. My grandfather on my Maynard side is a gentleman named Wayne Maynard, and his son Jeffrey Watts is my dad. And then Preacher Mike Cummins is one of my cousins, and so on and so forth. Some of you may have known Miss Etta B. Rebels or Dysan with her over there giving us all hamburgers, or not giving them to us, selling us hamburgers. But just to let you know who I'm from and stuff. So I was very pleased, and I tell people I was probably one of the most blessed people in the world, because I grew up in a very tight-knit family on both sides that knew I was loved, and that I was also trained very early in life to have a mission in the world. And so that's how nursing actually became one of my loves. I had been accepted to architectural school and changed and decided to be a nurse at the last minute because I had watched my grandmother suffer with cancer and die. And I was fascinated with the care that she got from nurses and how much they helped not only her but also the family. And so people ask me, well, how did you get to be a nurse? Because there wasn't any nurses in my family. But that's actually how I got to be a nurse. Tonight, my goal here with you is to answer your questions. I want to teach you about staying healthy. COVID is only one of the things that has really let us know how some of the health deficits that we have in our people. And I will tell you that I worry sometimes that we have survived a lot of onslaughts, whether it's racism, poverty, things like that. But some of these diseases that we're facing now, folks, is going to wipe us out if we're not careful as a tribe. You know, as the minister mentioned in his message of prayer, the Holy Spirit has given us wonderful bodies, but he's also given us minds. And so my goal, whether it's teaching in the School of Nursing or working in the community, has been, how do I help people understand how really fearfully and wonderfully we are really made? I'm amazed every day that I learn something new about the human body and the human spirit, and how those two have to work together to make us who we are as resilience and people. I'm going to tell you my passion is educating people about how to stay healthy. And so if you'll give me the next slide, the first slide, the next slide, whatever. Okay, so I titled this The Amazing Immune System. And I would like to tell you, I've been studying the immune system since I was probably 19. I'm 70 now. And so one of the things is I constantly am learning about the immune system and how our immunity works. But the one thing I'm going to tell you is it's also one of the fastest growing areas of healthcare, of science that we know. Some of the things that we're going to talk about tonight, we didn't even know, and I'm going to go ahead and tell you, it's messenger RNA. We did not even know how that existed until the 1970s, much less how to use it. But the Creator knew that when he created human bodies. We were given that. Science is just now, in lots of ways, catching up with some of the things that we've known. We've known, I've heard all of my life, well, somebody, wished themselves to die and they died, those kinds of things. It was when I got to be a nurse, I experienced that. I was working with a patient, and there was no reason that patient should die, but they died. And then I also had some patients, I was wondering, how in the world is this person still alive? That they would be waiting for someone to get there to tell them goodbye. And you've known that or seen that stuff. Now, science is finally beginning to catch up with how that works. So some of the things we're going to talk about tonight is how do we actually keep ourselves healthy? We're going to talk about looking at some of the ideas about how our immune system destroys infections. I want to talk to you about some of the ideas of what we can do about the different types of immunity that we have. Most people don't realize how complex it is, but also what a wonderful gift it is from the Creator. And then how do we want to use that to stay healthy throughout our lives? So, did we decide if our video is going to work or not? Okay. If it doesn't work, we can do it without it, but we're going to show it. It's a 5-minute clip. It kind of gives you a little bit of look into the immune system, and then we'll go ahead and, but I can talk about it if our video won't work. So I love this first quote. The human body is a conversation going on, both within the cells and between the cells. And so thinking about there's a conversation going on in your body every microsecond. And so then you're going to hear how quickly this immune system begins to work. One of the things I want you to remember, many times people say they use terms like leukocytes and stuff like that. But when we go to the doctor and they tell you they're going to do a CBC or they're going to do a blood test, look at that blood test. What they're doing is a complete blood count. They're counting how many red blood cells you have, how many white blood cells you have. And that's what a leukocyte is. It's how many white blood cells. You actually have 5 different kinds that are constantly circulating in your body. We only measure antibodies for certain diseases and stuff. So we did a research study at UNCP Pembroke fall of 2020 to see how many people in our community had antibodies already to COVID. And then what percentage of those even knew that they had been exposed to COVID. We found only about half the people who had antibodies knew of their exposure. And that's when we began to realize that community spread was going to be something we really had to pay a lot of attention to with our studies and our work. So if you'll give me the next slide. So one of the things I want to talk to you about is I want you to first of all realize that there are 3 levels of defense. And let's think about your immune system being antibodies. I will tell you, I'm a big sports fan, and I also have a son who's a Marine, and I was in the Army Nurse Corps. So my son always reminds me that the Marines get there first, that kind of, and we have a few discussions about that. But just that there's a lot of analogies in nature, a lot of analogies in our own system that mimics what our body does wonderfully. So we're going to walk through each of these stages. So the first one is the physical and the physiological barrier. We all have it. We just need to know how to keep it well. An innate immune system. Innate meaning what we think inside our bodies, innate. And then the whole thing of adaptive, which is the third one. So if you give me the next slide. Thought there was one before that. Nope. Go back then. I'm sorry. So in the physical and physiological immune system or things, something that we have all the time. The video said the skin is the largest organ in the body. The skin is the best thing that protects us from disease, hands down. It also, the mucous membranes in our nose, the mucous membranes in our mouth, the ability for our nose, and I'm going to show you that in a minute, how they actually work to capture bacteria and viruses. Well, I know people are telling me right now, well, my car's yellow, and that's why I'm having itchy eyes and stuff. And I have to remind people, actually, that pine spore is a little too big. Our body stops it. It captures it. It's all these other tiny pollen viruses, or pollen molecules that it can't capture. They actually cause the eyes to water, the throat, the itching stuff, and the coughing. We also have the idea of body temperature. You notice one of the first things you notice when you get sick, and one of the things we'd ask about COVID, what was your body temperature? That was the first sign. That was a very early sign that your body was responding to something. I have people all the time say to me, well, Cherry, what about, I had a temperature of 99, so I started taking Tylenol. No, don't do that. Your body used temperature to actually kill off things. Now, once it gets over 100.8, yeah, we like you to take something. But otherwise, let your body do the work it needs to do. And then also something called pH, how many, the acidity that's in our body, the acidity that's in our stomach, it actually prevents us from getting phenomenal amounts of illnesses all the time. So one of the things you can see, even from looking at these physical and physiological systems, that's why we ask people to wear masks. And I know I don't have mine on, but you can't hear me well if I don't have it on. That's what the mask does. That mask actually acts like another layer of keeping things from getting into your nose and your mouth. This virus loves to replicate in the back of the nose and in the back of the throat. That's why the COVID test, people said it felt like you're scrambling my brains. Well, that's because we had to go so far up in there to actually be able to capture that. Some of the things with the home test that we're doing, people aren't going far enough up in their nose or far enough back in their throats. And so they're missing some of the amount of virus. We hand sanitizer. I don't know if you've noticed, we didn't used to have hand sanitizers everywhere we went. Now we have hand sanitizers absolutely everywhere we go. And that's simply, again, we don't want to spread the virus on our hands. And then the other thing when we talk about making sure that we're prepared is social distancing, staying 6 feet. Because one of the things that we learned, unless you're singing or coughing, 6 feet is a good amount of space to have that this virus can't move. Now singing, we're looking at 9 to 12 feet, coughing about 12 feet. So when we're looking at, remember when our churches started back reopening, we may have spaced that or had different distance. That's why we had to do that. So if you'll give me the next slide. This is a picture of when we look into your respiratory system, what it looks like. And I don't have my pointer with me tonight, I'm sorry. But the very front thing on the top of the nose, and it looks like a pale pink, that's like huge alleys, huge canals of things that the air has to go through, and it's full of cilia. And so that's why they actually capture viruses, and they will hold it there for the rest of your immune system to come and kill, or coat it in the mucus, and then you sneeze it out or you cough it out or some of those things. But you can see that's a straight path to the back of the nose and to the back of the throat. And so that's also where this virus likes to get. If it can get past those turbinates, it actually has a better chance of reproducing. Again, another reason why masks are so important, and to help prevent that from happening. And then it goes straight to the lung. It's just a straight water hose, a straight pipe. And then what we're seeing with this is we know that the lung is where this virus actually causes the most damage, that and also the stomach. So remembering what happens in the stomach, if it's in the back of the throat, we can either swallow it down the esophagus, or we can breathe in it, put it in our lungs through the trach. And there's just one little flap of skin that makes where it closes something and allows something else to open. And it just depends on how quickly that is. So when people say to me, well, why did some people get it in their lungs and why did some people get it in their stomach? It's all because of how much virus there was in there and where it actually ended up, causing the most damage. Any questions? Please, if you have questions, I'm more than willing to answer them. Next slide. So the second line of defense is what we call that innate immune system. Everybody has the first one. Just again, depends on how much you keep your skin clean and wear your mask and keep your hands clean and use your social distance. That's the way of improving that. Then the innate immune system is an immune system that we all have, but it's not specific. It will respond to everything that's wrong the same way. And so when we talked about the video talked about the macrophages and those things going in there and being available and temperature and cuts on skin. So this mosquito bite is a perfect example. As soon as you get a mosquito bite, what happens? Immediately you start itching. It doesn't take long. That tells you how quickly this immune system actually starts working. You get a paper cut, it doesn't take long for it to start hurting or being tender. That's because immediately. So we know that it probably in less than 30 seconds, that immune system is actually beginning to respond. So it got past the skin, so 30 seconds later, that innate immune system is coming in. So if you give me the second line, please. Next slide. This is an example of what we've talked about. So a simple little cut, the bacteria comes in, you have lymphocytes that, there's something wrong here, I'm gonna chew it up, I'm gonna phagocytize it, I'm gonna eat it, it's gonna bring out, there's something that's not here, it suddenly starts sending a signal, chemical signal to your vessels, your arteries and your veins. They start increasing the amount of leukocytes that come. That's why it swells. That's why it gets warm, because it's doing all that. And the temperature actually tries to kill that bacteria locally. And so the other thing we have is something called cytokasms. Cytokasm is a partial cell that actually works with our immune system. And it's kind of like it starts that dominoing effect for us to start. So those are those chemical communication lines. And what actually you may have heard somebody talk about cytokasm storm in their lungs, and why people actually had such damaging lungs. Some people, when long-haul COVID, their heart and their lungs were damaged by the cytokasm. It's because the body was trying to fight it so quickly, it didn't cut off in time. And so that's what that is. It's called a cytokasm storm, and we measure it. So people actually, that's why we use steroids to treat it. We're trying to slow down that cytokasm response. So it slows down the immune system a little bit, but we don't want it to get out of control. So next slide. So then the third line of the fence is the one that may want to talk about the most. So it's passive and active. You have two different parts. Passive is things that other people can give you. A mother, when she has a baby, she passes all these antibodies and stuff through the placenta, through the umbilical cord to that child. And that child has some sorts of protection for about 2 to 3 months. A baby that is breastfed, that breast milk has huge amounts of antibodies. And up until about 9 months, that mother, as long as she's breastfeeding, is passing those antibodies. And that child's immune system has longer to develop, has longer to mature. It's called passive immunity. It's the preformed antibodies we're giving somebody. I think some of you say, well, what about so-and-so went and they gave them antibody therapy, or they gave them something to help with. And what we were doing was we were giving them the antibodies. We were not allowing their body to form them. And so what we did is trying to keep the disease down by giving people preformed antibodies. The bad thing about that is it stopped at that instant, but then it did not allow them the opportunity to develop their own antibodies. Because passive antibodies go away. They go away fairly quickly. The body is extremely efficient. If it's doesn't need it, it doesn't keep it. The only thing it keeps is memory with that active immune system. Once you've developed that, it absolutely never goes away. It always is there. And so as far as we know, humans are one of the few mammals that have such an acute memory in our active immune system. So you're exposed to something, you develop yourself. It's not something that somebody's giving you, that other people develop, and it has memory specific to that one virus. So just like it said to you on the thing, it's like a key, a lock and a key, and that's very much what it looks like under a microscope. It fits close. So then I got a variant that comes along called Delta, and it doesn't quite fit, right? But your body's seen a little bit of it before, so it doesn't take quite as long to develop the immunity. Same thing happened with Omicron. Why we had less people get extremely sick with Omicron. Remember, it was more contagious, but it actually, people had seen it. Their bodies had started developing some of the active immunity. So with that, what we ended up with is we saw it more quickly. Like I told you guys, I'm a sports fan. March Madness means that my favorite team, I'm not say which one. I am. I went to the University of Michigan to college, so I'm watching Michigan closely. And then it doesn't matter between the other North Carolina teams to me. I just like good basketball. But it's like having that other coach's playbook. You don't know what team's going to show up that night, right? Because I was saying the other night about Chapel Hill, I don't know which team's going to show up tonight. And same thing's true with Michigan, by the way, and Duke. But But so you don't know, and you don't know what the other team is going to show up. But if I got an idea what their basic plays are, I can respond and change my things more quickly. That's what your body is doing with these immunities that we're developing. That's all it's doing when it sees the different kinds of variances, when it sees the different kinds of variations. So now we got Delta Chrome. Guess what's happening? It's spreading through Europe like wildfire. We're being told that it's actually even more contagious, and we're being told that the people that it may affect the most in the United States are children. And the reason is they haven't developed as much immunity because we haven't had the virus here. So we've kept them home or in a little bit more isolation longer. Fortunately for them, their immune system is much sharper than my immune system. My immune system, as we age, decreases in its ability, increases the amount of time it takes to make some of these adjustments. But that child may actually not get as sick, but may actually be a good spreader because their immune system, that T cell, is running around killing them as fast as they can get them. Mine, it may take it a little longer. My grandchildren will expose me, and then I will end up being sick. So that is actually how, when we talk about the active immunity and the passive immunity, we want to treat all viruses. That's how we treat chickenpox. That's what measles, mumps, and rubellas are. We actually are able to give those ideas and that give you that antibody, and then we've also given opportunities to develop immunity. And so one of the other things that I want to just mention to you, when we talk about vaccines are not new, as you well know. We've had vaccines very early on. The first vaccine was actually developed to smallpox. And one of the things with smallpox is they noticed that the milkmaids that were exposed to cowpox from dairy farms didn't get sick. They got the pox, but they didn't get sick from it. And so that's how we've begun to realize some of these, by small exposures, we're able to do that. The other thing I want you to remember is we do flu vaccines. So we do flu vaccines every year. I'm here to tell you that we're probably going to be doing COVID vaccines every year. It's probably begun like the 1918 flu, which was a new new virus for our country. It wiped out huge sections of the population. It actually wiped out about 20% of all nurses in the country. People that were exposed to it are soldiers in Europe. They brought it home after World War I. We had not seen it. We had not seen that gradual development of it in our country. People got on ships and stuff and immediately came back. Well, now we've got this world global society that quickly gets on an airplane and they travel somewhere and then bring it to a community. So one of the things that happens with the flu vaccine is it's a vaccine that, again, lets you begin to keep your immune system in tune. So when I get a flu vaccine every year, I've actually seen the flu vaccine that was here the 3 years before and the one that was in China that year. And the reason for China is viruses spread east to west. They spread on the trade winds. They spread in things. There's certain areas that they're able. Do you need to tell me something? Okay, got choir practice in a little bit. I'll finish up. So they're quickly seeing that and then trying to develop a way so that we can see it quicker. So that's why sometimes flu doesn't seem to make people extremely sick. Sometimes it makes them very sick. What happens, the other thing is people say, well, I got that flu vaccine, Dr. Beasley, and I've never been so sick with the flu in my life. I'm not going to ever get another one. The reason is your immune system wasn't in tune. You hadn't done the things to your immune system to keep it going. Immunity is wonderful. I told you it has memory. Every time you're exposed, the antibody level goes up. Then it's not being used, it starts dropping. And then the next time you're exposed, it goes even a little higher, and it doesn't drop down quite as low. So every time you're seeing this, and that's how boosters work. It allows you to see it, your immune system gets in tune. Those antibodies are going to drop. They just won't drop as low as they have before. Next slide, please. So we've got lots of different things involved in our immunity. We've already talked about the fact that T cells are a wonderful thing. They have the ability to identify and kill cells immediately. I can tell you if we did autopsies or did PET scans on all of us tonight, probably all of us have had numerous forms of cancer. Those T cells are so wonderful that they've actually gone and diagnosed and killed the cancer before we even knew it happened. So the other question I get a lot is, well, why is this is a new science with this vaccine? It is not a new science. We actually started developing this science for vaccines in the 1990s. First time we started the real research on the messenger RNA vaccine was in the 2001 with the first SARS epidemic. We responded, we started improving it, and with the second SARS epidemic, most people don't realize with the second SARS epidemic in 2008, we had 60,000 deaths in the United States. So, but we learned quickly, and fortunately, it was not as virulent as the one we have now. The traditional vaccine that we know has to be developed in a special lab because it's either live viruses or viruses that we have to capture and then kill, and then make the vaccine. Messenger RNA is also, just like I told you, giving that body your playbook. We don't have to make your body respond. We give your body the playbook by which it can develop your antibodies. And so that's what a messenger RNA virus vaccine does. We don't involve that whole body, that body response. We give it the playbook, and then it tells your body how to start making those antibodies. And so that's one of the things that's different in it. Next. And so what do we want to do to prevent COVID? I want you to take care of yourself and others. Next, please. I want you to wash your hands, wear your mask. You know, remembering we're talking about that we're talking about that first barrier, right? Secondly, I want you to get enough sleep. Your body needs sleep in order to develop its immune system. Your immune system, if you're getting less than 6 hours of sleep a night, is actually not attuned to where it needs to be. The human body needs between 7 and 8 hours of sleep a night. So what do you have to do? You're going to have to turn off your TV. You're going to have to turn off your telephone or your phone, not wake up in the middle of the night and see who's on Facebook or Messenger or whatever else you're doing. You've got to, because that stimulates a special part of our eye with a special light, and it stops the development of serotonin. And so the serotonin and the melatonin communicate to improve our immune system. So sleep is critical. You also go through something called stages of sleep. It's only in REM sleep, rapid eye movement sleep, that your body repairs itself. I happen to wear a Fitbit so that I can check my sleep stages at night. You don't start really doing REM sleep until you've been asleep for about 4 or 5 hours. And so if you're getting less than that, your body's not getting the repairing that it needs. So I need you to get sleep. Next, please. Eat. What do we need to eat? We need to eat good, solid food. Fruits and vegetables are critical. The darker the color, like my pretty brown skin, the better it is. It has the antioxidants in it, which are things, and vitamin A and vitamin C that your body needs to improve that immune system. So eating what you're doing. I happen to love collard greens, and I could be an easy vegetarian. I'm not a great meat eater, but I also have to make sure I'm eating protein, because protein is also that building block of our immune system. So if you don't like meat, eat a lot of beans and stuff like that. Secondly, the last thing I want you to consider doing is getting vaccinated. Because as I've told you how the vaccines actually work. Just like every other vaccine we've ever had and we ever will develop, they're not perfect. Every other vaccine we have has actually caused some children people to get sick from the vaccine. For instance, you may have a child that they got their 2-month their 2-month measles, mumps, and rubella shot, or they're actually DBT, and they didn't have any problem the first one. The second one, they got sick. That body was like, okay, wait a minute, I saw this recently. I'm going to go ahead and try to wipe it out. So they over-response. But we also know that some children immediately will have some seizures or develop high fevers. It's rare, but it actually still does happen. So I will tell people, yes, there are some side effects from this vaccine. It's not as much as the normal traditional vaccine, but I'm not going to stand here and tell you something that's not true. There are some things that we have to be careful for. So that's why when we worked with CORE in developing our vaccine program, we want to make sure that people get educated. We want to make sure that people have all the information they need and also know where to call and ask questions the next day. Where do you need to get followed up on? And making sure that we talk to you about keeping that immune system as healthy as possible. The one other thing I want to say is that we have a lot of asthma in our community. Asthma is a autoimmune disease along with arthritis. And now we realize not just type 1 diabetes, but some type 2 diabetes actually has an autoimmune component. We have a lot of lupus in our community. People who that doesn't mean that they shouldn't get the vaccine. Actually, they should be getting it more earlier because then they're going to need the extra help in avoiding these getting sick with this disease. You have a packet of stuff, has a lot of information in it, including stress balls. The reason we have a stress ball in there is that COVID has caused all of us to be stressed out. Whether it's being able to get together and hug and do all those kinds of things, or it's just the fact that, one more person in my family is dying. Well, I've heard one more person that's sick, one more person that's sick. And so we've got some things in there in that packet of information that you can use as far as helping with mental health. Everything in that packet can be copied. It can be given away. It's not anything that is copyrighted. It's actually developed by the CDC and SAMHSA, so that it's on the public domain. Our tax dollars paid for it. We just had to pay for the copying, but it's other things. If you want to use it, please feel free to use it. Questions of me? I don't know who has to go to choir practice, but I think I finished in time. The what shots? Anthrax, no. Anthrax is not a virus, it's a bacillus. And it is not a messenger mRNA vaccine. So there's the messenger, the COVID vaccine, if you, the Moderna and the Pfizer are messenger mRNA. What was the other ones? Johnson & Johnson was the old-fashioned one. So I have people say, I only want this kind versus that kind. That's why. But anthrax is a completely different. The vaccine works the same way all vaccines work, but they can't be exchanged or interacted between the two. That answer your question? Okay.